Chairman, ladies and gentlemen, a philosophical question possibly for us to start the session with. And I put it to you that if it's true that microorganisms so easily contaminate hands and survive for periods of 2, 3, sometimes 4 hours, surely it's only common sense that if they're not removed, there is the potential to transmit them to some unwitting victim. Now, this is one of my favorite slides, and it shows quite clearly, this is before hand hygiene of a junior doctor. And the hand with the watch clearly has no chance of being washed around that area. And we use this slide when particularly the medical director needs to talk to one of our junior doctors, and it is really quite a graphic picture of just why we do need to be bare below the elbows. And of course, if we have a think about what's gone on, let's have a think about what's gone on in 2012 and 2013. We've had the Francis report, and we've had the Keogh report. And I'm very pleased that nowadays, infection prevention and control is not a bolt-on extra anymore. It's firmly and squarely part of the patient safety agenda. And indeed, both of these reports focused, didn't they, on patient safety and fundamental standards. And I think it's really well established now that hand hygiene is probably the most basic of all patient safety interventions and the most fundamental of all fundamental standards. And so we just need to keep that in our minds as we go through this afternoon. Now, the World Health Organization really reiterated what Florence Nightingale said, didn't they? The emphasis that universal health coverage must go hand in hand with ensuring that healthcare systems don't actually harm the very people they're actually built to serve. And the WHO and its first Global Patient Safety Challenge they use this word sustain. And I think very often that, it's not just getting there, it's actually keeping your position. It's about having good infection rates, but it's also about sustaining them. We've got new junior doctors, we've got new nurses who haven't seen the problems of 10, 15, 20 years ago. And it's about those fundamental standards being in place all of the time. And I think that's our challenge. And it's a patient safety challenge. It's not just infection prevention and control. Now, Stone et al. Published some research in the BMJ a year or so ago showing that the Clean Your Hands campaign, that is now a distant memory, was actually a very successful campaign. They particularly showed strong independent associations between procurement of alcohol hand rub and soap, and declining rates of MRSA and C. diff, and that was their particular outcome measure in that paper. Other papers throughout Europe have shown, with similar interventions, have actually shown very similar results. And the campaign's external reference group did advise that the Clean Your Hands campaign should continue, but sadly the campaign, as you know, closed. Subsequently, the Hand Hygiene Alliance was formed, and this is a group of individuals and organizations that, I'm using this word again, aim to sustain the achievements of the Clean Your Hands campaign, using the best available evidence and aiming to ensure that this high standard of hand hygiene continues to be a fundamental standard. And it's working, the Hand Hygiene Alliance is working through agencies that are emerging in the newly configured NHS for commissioning, for regulation, for education. So that group is there to help sustain the Clean Your Hands campaign. Also, the external reference group talked about audit and feedback. And we've heard quite a bit about this morning, haven't we? Audit where, you know, a lot of us are showing 100% hand hygiene in a lot of our areas. But I think we know in our heart that actually probably hand hygiene is nearer 35–40% at best. Fundamental standard. So the Clean Your Hands expert reference group talked about hand hygiene observation being taught and perhaps being the focus of a new campaign. So audit and feedback. How are we actually going to achieve this? If I just go back to this slide. We've heard already this morning about feedback. The Stone Group, the Stone Research Group, also produced a study, a paper a year or so ago, showing that the best and most effective feedback is at the time. And this actually happened to be on hand hygiene, but it could be any aspect of patient care, any aspect of patient safety. So if you go on a ward and you do something that is counter to the standards of that ward, if you've got somebody there saying, oh, look, you know, Dr. Bloggs, Nurse Bloggs, you don't do it like that round here. This is how we do it. That's very effective feedback. And this is what the Stone Group showed. And I think we all know, don't we? I was on a ward recently and I saw what shouldn't have happened in relation to hand hygiene. There were a couple of staff nurses there. And I said to them afterwards, why didn't you challenge those doctors for not washing their hands at the time? Why don't we have, I think this morning somebody mentioned, I forget who, talked about patient safety champions. Patient safety champions should be on every shift. They should be setting the standards of the ward, of the hospital. And if people are not actually at the level of whatever those standards are, the fundamental standards of hand hygiene, of patient safety, people should be picked up at the time. Look, guys, if you want to work here, these are our standards. This is what we expect you to do. And you probably won't have problems again. So bedside observation is labour-intensive. It is difficult. I think we've already heard today about alternatives, about electronic alternatives, and I think those will be important for the future. So I reiterate, hand hygiene is the most basic of all patient safety interventions, the most fundamental of all fundamental standards. And yet 4 years after the closure of the Clean Your Hands campaign, we still have the need to be questioning and to be ensuring that this is a well-established part of clinical care. And I'm going to leave you with a patient's voice, and this is a patient that said to me, hand hygiene, such an easy thing to do. Why isn't it done? Thank you.